than 1 minute. Ist es erlaubt, dass ich hier sitze?
Das ist wunderbar.
Ja.
Welcome, everybody. Thank you for coming. We're so happy to have you here. My name is Julia Mahecka, and I'm a project officer of Impact Vaccination from Jerusalem. And before we start our event, we have a few notes to you. First of all, we unfortunately have a time limit, so there won't be a Q&A session, but you will be able to ask any questions after the event, and the panelists and the speakers will stay for a while to answer any questions you may have. And secondly, there is a live streaming of our event, so just for your information, you might be on camera. I hope that's fine with everybody. And finally, you have the folders on your chairs, and as you can see, you have the bios of all speakers from today in the folders. So if you're interested, you're welcome to read all the bios. And without any further ado, I invite Dr. Inon Schenker. He's the chair of the Impact Vaccination, and he will lead the event. So thank you very much for being here, and welcome.
Thank you very much, Julia. We are actually a very cozy room here in Karlsruhe, in Germany, but this streaming live to the world means that there could be, at this very moment, a couple of hundreds of people, if not thousands, that will be joining, and others will be able to actually see the recording when they are free. We have taken a light approach, so I've taken off my jacket and the tie, and the idea is really to have a very cozy, collaborative meeting. It is a pleasure to let you know that we have received in writing few greetings, and we also have people who have joined here with us to greet the audience and to greet this event. The first will go not by hierarchy, though we have a ministerial thank you for the decision to hold this event here. It comes from the person who is responsible at the Baden-Württemberg land, which is Dr. Michael Blume. He had sent greetings to all of you, to all of us, commenting that this is a very important event. He is unable to join us here, but as I said, he had sent greetings to us and to the world that is interested in this unique junction between public health and faith. The other person coming from the level of the ministerial level of health in Baden-Württemberg, this is Dr. Gottfried Roller, who is also commenting in writing that he would like to see also the report on this meeting, as well as the understanding how important it is, specifically in times of pandemics as we are now, to actually have this highlighted, the importance of community influencers in the direction of faith and public health coming together. Here with us are quite a number of distinguished other personalities, and I would like to first and foremost invite the City of Karlsruhe representative, Dr. Albert Koflein, who is the Deputy Mayor. Lord Mayor Frank of Karlsruhe could have not attended and suggested, and we are very happy to have you, Albert, be the first person to greet us in person here. Please.
Ja, vielen Dank. Sie erlauben, dass ich auf Deutsch spreche, das fällt mir leichter, aber es wird ins Englische übersetzt.
Thank you very much. I hope you allow me to speak German and it will be translated to English.
Ich möchte zunächst einfach ganz herzlich willkommen sagen in unserer Stadt. Wir freuen uns sehr, dass dieses Weltereignis stattfindet hier. Die Entscheidung fiel ja am Ende zwischen Kapstadt und Karlsruhe und wir versuchen einfach gute Gastgeber zu sein und insofern bin ich auch gerne persönlich hierher gekommen. Ich besuche ganz viele Veranstaltungen und begrüße die Damen und Herren, die da sind.
A warm welcome to all of you here to Karlsruhe. It is a big honor for us to have you here in Karlsruhe, this very worldwide event. It's very, very special to be the host for you here as a city representative of Karlsruhe. As I've heard, the decision in the end was between Kapstadt and Karlsruhe, so this provides us a special honor that in the end they decided for Karlsruhe.
Ich möchte zwei Dinge sagen zur Stadt
I want to
und auch
say
zu
two
dem
things to the city
Ort, an dem wir sind und zwei Dinge zur Veranstaltung.
and also especially about the place where we are exactly here and also two things about the event
Und ich
itself.
fasse mich kurz, weil Sie nicht wegen meines Grußworts gekommen sind.
And I am very short in my words because you didn't come only for my words.
Aber ich muss auf den besonderen Ort hier hinweisen. Wir sind im Schloss von Karlsruhe, das wissen Sie, das ist klar.
But I have
Wenn
to
Sie
refer to this very special place here in Karlsruhe. We're in the castle and here behind me,
Wenn Sie gerne nachher einfach mal nach hinten gehen und sich genau in die Mitte dieses Raums stellen, dann sind Sie in der Mitte der Stadt Karlsruhe. Denn der Markgraf, der das mal hier so entworfen hat, geplant
when
hat,
you afterwards have the possibility to maybe just move on to the next room here, this is exactly the tower of the castle. And the Markgraf,
Karl Wilhelm,
Karl Wilhelm has decided that this is the structure of Karlsruhe. This is the very, very city center of Karlsruhe.
also das ist der Stadtmittelpunkt hier, der Schlossturm. Wenn Sie sich da hinstellen, sind Sie genau in der Mitte der Stadt.
When you stand there, it's exactly the middle of the city because that's how the whole city have been structured.
Die zweite Bemerkung zur Stadt. Dieser Karl Wilhelm hat Menschen in die Stadt gelockt, indem er seine Gründung 1715, indem er bestimmte Privilegien erteilt hat.
So my second remark about the city here in Karlsruhe is that the Markgraf has especially invited people here in 1715 by providing special benefits.
Und eines dieser Privilegien, und das ist für das 18. Jahrhundert ganz ungewöhnlich, war Religionsfreiheit. Das
And one of
Herrscherhaus
these
war
ben-
evangelisch, aber es durften Protestanten, Katholiken und Juden sich in der Stadt niederlassen. Ganz, ganz ungewöhnlich für die damalige Zeit.
And one of the big benefits was to provide freedom of religion here. And back then in the 18th century, that was very unique. So he really attracted Christians. The house here was Catholic, but Protestants, Jews, Muslims, every religion.
Und deswegen sind wir bis heute einfach eine bunte, eine vielfältige, eine weltoffene Stadt. Und insofern passt Ihre Veranstaltung heute, diese Veranstaltung, aber überhaupt die Vollversammlung des ÖAK sehr gut zu uns.
And that's why exactly this event, this worldwide event, fits exactly to this very colorful and very people-oriented city here. And it's very good to have here the WCC.
Jetzt zwei Sätze zur Veranstaltung, deswegen habe ich den Zettel hervorgeholt.
Now, two remarks regarding the event.
Mir gefällt sehr gut, dass Sie hier formulieren, dass Sie die Zusammenarbeit von Wissenschaft und Religion unterstreichen, dass Sie die befördern wollen.
I love it a lot that you want to emphasize the collaboration between faith and science. That is what I really like a lot.
Der von manchen behauptete Widerspruch zwischen Religion und Wissenschaft oder zwischen Glauben und Wissen wird, das kann man historisch nachweisen, von ganz bestimmten Kreisen befördert, nämlich von religionskritischen, von christentumskritischen, von kirchenkritischen Kreisen. Dieser Widerspruch besteht nämlich überhaupt gar nicht.
So some people might say that there is this contradiction between religion or faith and science. But I'm absolutely convinced, and you can prove that historically, that this opinion is emphasized by religion-critical people, church-critical people, Christian-critical people, and circles.
Ich weiß es deswegen ein ganz klein wenig, weil ich Philosophie und katholische Theologie studiert habe.
I know it a tiny little bit because I have studied Catholic theology and philosophy.
Eine zweite Bemerkung, mir gefällt ebenfalls sehr gut, dass Sie sich mit einer großen aktuellen gesellschaftlichen Herausforderung beschäftigen, nämlich mit dem Thema Impfen.
My second remark is that it's very dear to me that you talk about a very social important, a topic which is socially very relevant, like vaccination.
Religion ist ja das Verhältnis des Menschen zu Gott, darum geht es, aber religiöse Menschen haben eine Verantwortung für sich, für andere, für die Welt, und insofern ist es genau richtig, dass Sie sich heute wie andere Foren mit Themen der Welt beschäftigen und vom Standpunkt der Religion aus diese Themen aufgreifen. Das ist das Zweite, was ich lobend voranstellen wollte.
So, religion is a relationship between God and man, human being. But as a Christian, as a faith people who believe, there is a responsibility towards the other people, towards society. And that's why I'm very happy that you deal today with a topic which is very important to people and to take responsibility for each other. And more or less, yeah.
Insofern ganz herzlich willkommen, schön, dass Sie alle da sind und danke, dass ich Sie begrüßen durfte.
So therefore, thank you very much for coming. Thank you that I could greet you and enjoy the event.
We have 3 more voices, quite important to listen to. It's a Muslim voice, it's a Christian voice, and it's a Jewish voice. Obviously, these are not the only religions or faith in the world, but these are the ones which we call the Abrahamic religions, and they are present here. And I would like to call first Rushto Aslandur, who is the chairman of the German-speaking Muslims here in Karlsruhe, to greet us in a few words.
Thank you. I'm honored to be the first one here, and I'm a local citizen, and it seems to me that it's just repeating content of our mayor, what I want to tell. So good afternoon, ladies and gentlemen, and good afternoon also my new dear friends. When we speak about the role of religious leaders to fight the pandemic, we speak about how science and religion should cooperate together or come together, because this is the fundamental understanding how to fight the pandemic. And this leads us to the question, what is the relationship between science and religion? We Muslims believe that there are 2 kinds of revelations. The one is God sent revelations to Moses, to Jesus and Muhammad, peace upon them. That means that he sent down the Torah, the Gospels, and the Quran to his prophets. The second book that God sent to all human beings and to man is the book of universe. And this is the subject of the science, that the scientists should explore the universe. In that understanding, religious leaders and scientists should work in harmony together to come together to these 2 revelations. The scientists lead us to with their scientific facts, how to do it, and the religious leaders give the ethical framework and how to motivate society, in the society. And this is what I think we can discuss also today. Thank you.
Thank you so much, Rushto. A Jewish voice will come from Rabbi Moti Mordechai Mendelssohn, who is also a local Karlsruhe person, and we invite you to bring to us a Jewish voice.
And I'll try like Dr. Käuflein, I'll try also to speak in German. Okay. Es ist für mich eine große Ehre hier.
Then we need a translator who
Okay.
has already heard
This is better.
second.
Okay. I will make it short, it's really double
Please.
time, okay? Ich hoffe, dass die Chaos, was war in letzter Pandemie, was manche haben die Religion benutzt gegen Gottes Segen, das kam hier durch die Ärzte, wird nicht mehr sein.
I hope that the chaos, what we all experienced during the pandemics, and also that the blessing which we received from Hashem through the doctors and the rejection of that this will not happen again.
Gott gibt die Menschen die Möglichkeit, die wunderbaren Sachen zu nutzen, aber es gibt Menschen, die lehnen das ab und Gott kann sie nicht zwingen, ja?
God provides the beauty and the blessing and the beautiful things and tools, but He's not forcing the people. So He's giving the free will for them to choose if they want to use it or not.
Davor, ich bin sehr, sehr dankbar, dass Rabbi Steinberg und noch andere Menschen, die hier sitzen, haben viele Mühe hingelegt, die Spitze von der Religionen zu erreichen und so die Menschen zu beeinflussen zu können. So Gott segnet euch und machen Sie so weiter. Ich hoffe, dass keine zweite Pandemie wird kommen, aber wenn, dann machen Sie weiter.
I'm very honored to have Rabbi Steinberg here, and I want to honor all his efforts to bring also the faith-based leaders together and to.
Dass Sie haben die alle Spitzen in die Religion erreicht.
They
und Sie
have
haben
reached to the tops of multiplicators within religions, and I'm very thankful for your efforts, and I want to honor this, and God bless you for that, and keep doing the good work what you are doing. Amen.
Thank you very much, Rabbi Mendelssohn. A Christian voice would come from Dr. Andreas Hermann, who is representing the Evangelische Kirche here in Deutschland, which is a very important organization throughout the city, the land, and Germany on a federal level, but also important because, as you could see, the EKD sign here, this has been the organization that has collaborated closely with us. So there is a new link between Israelis and Germans in conducting such an effort in trying to address pandemics. Mr. Dr. Hermann, we are very happy to listen to you.
Yeah, thank you very much for inviting me for this event. It's the first time for me too to be in Karlsruhe, so it's a good impression. So, and I live right now in Hanover. I work there at the church office, and I am responsible for the interreligious affairs in Hanover, and I'm in charge of these relations. So we have different steps in interreligious dialogue. Maybe the very first step is to see at each other, to look at the faces. A next step may be to learn more, to listen. Many different steps. I think right now we are ready to do and go a further step. And I think you are about to do this because it is more than talking if you cooperate with each other. When religions talk about their Bible, about the Quran, about the Torah and so on, but the next step is to work together. Therefore, thank you very much for being here, and I wish you and your event here a big success. May God bless you. Thank you.
We are moving to the first part of the substance of our meeting today. It's been really important to have listened to those who have presented here some greetings to all of us. It's dear to our hearts what you have said, and we really appreciate it for you to come and greet us here. We will have now 3 TED type of presentations. These will be short 10 minutes presentations that will set the stage for the next part of our event, which will be a panel to be followed by these presentations. Our first presenter is Benjamin Goldberg. He is coming from Me'uchedet Healthcare Services in Israel, one of 4 of the organizations that have been able to basically vaccinate a whole nation in a very speedy way. People from around the world are still amazed of how Israel, 9 million people, has been able to be vaccinating its population with 4 vaccines to protect them from COVID-19. And as we are coming to a very difficult winter, that's not my observation as a public health expert, but it is really the WHO that has already presented the forecast for this coming winter to be a very difficult one in terms of influenza, COVID, and we know that there are other problems that just around the corner. So Benji will talk to us about how an organization has been trusted with the public health need to very quickly get organized and be able to vaccinate a whole nation. Benjamin, please.
Thank you very much. First of all, I want to say thank you for hosting us. It's a wonderful city. It's a gorgeous palace. It's really an honor to be here, and I'm very humbled for the opportunity to represent my organization, my peers, my colleagues for the vaccination operation which took place in Israel. My name is Benji, as Dr. Shankar mentioned, and I am the Director of Planning and Administration for Me'uchedet, which is one of the HMOs in Israel. A little bit about Israel. We're 9.5 million citizens. 70% were COVID-19 vaccinated with a Pfizer, at least 2 shots. 30% were unwilling to vaccinate from choice, not because we don't have enough or they didn't get in line soon enough, but democratic state, and they chose not to get vaccinated. 74% of the citizens of Israel are from a Jewish background, 21% from a Muslim background, 2% other, which basically means mostly Christian. Israel provides free medical health care for all its citizens, varying from the age of 0 until health maintenance organizations are divided by 4. I represent Me'uchedet Health Fund, which is the largest health fund within the Jerusalem region. I want to rewind a little bit. February 21st, 2020, we all heard about the COVID-19 outbreak that started from the Far East, spread to Europe, and obviously to the rest of the world. In Israel, it represents the 21st of February, the first record of a patient with the COVID flu within Israel. She came back pregnant from Italy, and as from that day, we were screening and testing, fully uniformed, and dealing with this pandemic from within our organization. Fast forward to December 2020, just about 9 months after, we're getting ready for a mass vaccination operation within Israel. I remember, I think we got the call 2-3 days before, said, get ready, the vaccines are on the way, prepare, make the vaccination centers, make sure you do it as best as well as you can. First shipment of the vaccine from Pfizer came in Saturday night. I think it was like 11:30 at night. Everybody was excited. We truly felt, not that the Messiah was coming, but that there was actually hope and a lot of light at the end of the tunnel. There's a saying in the Torah that "Amatzil nefesh achat kilu etzil olam umlo," which the translation is, "He who saves one soul is as if he saved the whole world." And we truly believed in it. We set forward on this vaccination operation. You can see the small little miniature vaccines that were used, and we were on a mission. We truly felt that every life that we save and every vaccine that we provide, we're saving lives and we're saving the world. Our goals was to eradicate the COVID-19 via Pfizer vaccine, obtain sufficient scientific data, and develop a know-how COVID-19 vaccine strategy. Yes, the vaccine was proven in the labs, but Israel was basically one of the first countries to bring it forth within the whole country and to see the outcome of the vaccine. We wanted to maximize all resources to expedite the national vaccine operation, manage supply and demand, while minimizing vaccine waste, maximum vaccine accessibility while minimizing infection. A lot of people, in a very, very short amount of time, wanted to get vaccinated. And as you all know, social distancing is very important, as we still see here in Germany. And one of the concerns was, as many as the people that will come to get vaccinated, we wanted to prevent from getting infected from the disease. So that was a challenge. I'll show you a little bit later how we got through it. And obviously, it's a trial and error. It's on-the-job learning. This is something we weren't prepared for. We understood that this is a huge task, and we knew we were going to learn along the way. So a little bit was mentioned here about the connection between science, religion, and emancipations, and community leaders, religious leaders, health departments, HMOs. Everybody has to work together. Religion, it shouldn't work with science. It must work with science, and it's one of the keys for the success. I'm going to 100 days passed, and as you can see, the outcome on the two green pyramids here represent that in the first 3 months, the amount of people that got vaccinated in Israel was significantly larger than the rest of the operation. We're talking about December, January, February, a little bit within to March. Most of who wanted to get vaccinated with the 2 shots got vaccinated, and then surely but slowly, it kept on going. We stepped down to the younger ages of 16, 12, and then even to the age of 5. We weren't sure when we got the vaccines, December 20th, 21st, how many people are actually going to come? How fast are they going to come? Are they going to, from all the sectors, from all the population? We were surprised. Masses of people came. Obviously, the vaccines were provided first for the ages of 60 and above. And these were people that were in the houses for a very, very long time, secluded. And the first time they actually came out was to get vaccinated. So they were very fearful. They were very excited and anticipated. And in a very short amount of time, we understood that in order to vaccinate, to expedite the vaccination, to be able to give the supply and demand, we had to open up larger mass vaccination centers. This is an example of one that we opened up in Jerusalem at 30 booths for providing the vaccine, and worked 14, 16 hours a day to provide as many vaccines as possible. Another thing that we did was, in order to get to the further communities, within the first 3-4 months, we opened up 30 vaccine stations in the greater Jerusalem area, but we catered to community needs and traditions, in order to maximize adaptivity and accessibility to the vaccine, which basically means communities that need special modifications, how the service needs to be provided for these communities were accessible and basically matched in order to make sure that they will all come and all get vaccinated. It doesn't help if you only vaccinate half of the city. You need the whole city. And when the city is populated with different backgrounds, religions, communities, and beliefs, it's a little bit more challenging, and we were able to hit that point. Rains, snowstorms, morning, evening, nights, weekends, they came out. It's a great example. We had a good snowstorm. It doesn't happen very much in Israel. And, whoops. I got it. I'm good. Someone came out walked a kilometer and a half, blanket. Hello, I'd like to get vaccinated, please. Sure, come on in. Anyway, it was an interesting period. There's another saying in the Torah that I want to use. It basically says, Al tashlicheni le'et zikna klechlot kochi al ta'azveni. It means, cast me not off in the time of old age. The elder, the sick, the ones who weren't able to reach us, to come out and get to us in order to get vaccinated, we deployed a mission in order to get out to them. Volunteers, hospitals, ambulances were used and set forward in order to get to their homes and give the vaccination. It doesn't matter what their backgrounds were, their religions, or their beliefs. We basically managed to reach out and get to everyone who wanted to get vaccinated. This woman here is 92 years old, and we sent out a nurse in an ambulance to be able to get her vaccinated. Finally, my staff members within the Mass Vaccination Center represented all the communities, religions, and beliefs within Jerusalem, and really unified, came together in a very strong and powerful manner in order to be successful in this vaccination operation. And for me, it was just a joy to see how religion, beliefs, backgrounds just were set aside. And just the will to provide life-saving medicine within the crisis came forward, and it was a wonderful thing to see. So thank you very much. It was a pleasure being here.
Thank you very much, Benjamin. So our global travel continues from Karlsruhe to Jerusalem and now to Durban in South Africa. And it's a great pleasure to introduce to you Dr. Douglas Ross. Dr. Douglas Ross is not only a manager in the healthcare service in South Africa and a very important physician, he has also been for many years involved with the Cathca organization. And Cathca is one of the leading Catholic organizations that provide healthcare services not only in the country South Africa, but also in Eswatini, it's a tiny other country next or surrounded by South Africa, and Botswana. We are honored to have you, Douglas, and to listen, for many of you, for the first time, I'm sure, to an extraordinary collaboration between Muslims and Jews and Christians in South Africa.
Thank you very much, Enon. Thanks for this opportunity. I'd like to just start with an opening comment to say that the world has dealt with pandemics and plagues for thousands of years now. And effectively, that means that the global faith communities have had to deal with pandemics and plagues as well. It's not a new experience for the global faith community. And we can learn from how faith communities have responded to various pandemics, such as the bubonic plague or Black Death, Spanish flu, and more recently, HIV/AIDS, which we've over 40 years into HIV/AIDS. And my particular context for my presentation is the HIV pandemic sort of country of South Africa, and in particular the province of KwaZulu-Natal, where I'm from. And I'm about to tell you a story that connects Jesus, Abraham, Socrates, King Gudrun Zeltini, and Karlsruhe. There's a very younger version of me there. St. Mary's Hospital, Marion Hill. It's a 200-bed district hospital. There's a picture of it there. It's situated on the outskirts of the port city of Durban. It's a Catholic mission hospital, or it was at that time. It is a referral hospital for 16 public sector community primary healthcare clinics, 2 community centers, and we basically catered for a population of just under 1 million people. And the community that we serviced was largely poor, under-resourced, lack of access to jobs and education. So this is a quote from one of South Africa's famous citizens, and the point that Desmond Tutu is making here is that, and I think you could just as easily use the word COVID as HIV/AIDS, is that we need to stand together, shoulder to shoulder, heart to heart in the fight against HIV and AIDS. And in my time at St. Mary's, one of the most moving experiences that I had to deal with was I was doing a morning ward round in the children's ward, and I was examining a 5-year-old child who had advanced HIV, extensive TB, critically ill, and the child told me that he wanted to go home, you see. So, and I said to the sister, but you know, he's not going to go home. And the next morning when I came for the ward round, he wasn't in his bed. And I will never forget that I hadn't really interpreted his going home correctly, because he was basically telling me, I'm going to die. And so that has stayed with me forever, that interaction, where I was a little bit slow on the uptake in terms of reading the patient's communication. Now, South Africa was, at that time, and remains the epicenter of the global HIV pandemic. We have got the largest epidemic in the world. 20% of the people in the world who are living with HIV live in South Africa. And we've had for a number of years the largest number of people also on antiretroviral therapy. It's a sort of unenviable reputation, that. So of the 8.2 million people in our country who are living with HIV, about 5.5 million of those are on antiretroviral treatment. In our province, the HIV is rampant, and currently the prevalence is about 27%. What does that mean? It means that 1 in 4 people you're walking around the street are HIV positive. So we still got a big problem. At the time of the project I'm going to tell you about, it was 37 to 39%. So we have moved the needle down, if you want, but we've got a long way to go. And one of our innovative and leading edge programs, which involved an explicit interfaith partnership, was our voluntary male medical circumcision program, which I'll use today as a good example of both interfaith collaboration and faith in action. Remember our words from Desmond Tutu. So a little bit about male medical circumcision, and in this case we're going to deal with male circumcision first. It's the oldest surgical procedure known to man, and it's the most common and ancient surgery in the world. There are 600 and more million Muslims that have been circumcised. Every Jewish boy is circumcised on the 8th day after birth. Jesus was circumcised. And in America, it's still at least 60+% young boys are circumcised early on in the first month. So it's still a fairly high proportion of circumcision in America. But the reason why circumcision became so important in HIV is engaged what's to do with prevention. Because in 2005, there were 3 randomized control studies in Kenya, Uganda, and South Africa that showed unequivocally that circumcision had an additional function, that it prevents HIV infection. So you might say, okay, well, how does that work? So what we discovered was that voluntary male medical circumcision was a one-time efficient, safe, cost-effective, and cost-saving intervention in reducing by over 70% HIV transmission in heterosexual relationships. It offered men partial protection against HIV, and offers both women and men protection against other sexually transmitted infections. And also the whole process provided an opportunity to increase awareness of HIV status among millions of men and boys who in Africa at least, not that keen in coming into the healthcare sector. So if you can get them to come in for circumcision, you catch them and you talk to them about a whole lot of other things while you've got them. And since 2007, circumcision has become a highly recommended practice for HIV prevention in Sub-Saharan Africa, including South Africa. Now in KwaZulu-Natal, there's a picture of someone we know and someone you don't know. That's Inon and King Goodwill Zelatini. 2 things happened. In a display of visionary leadership, the Zulu King, King Goodwill Zelatini, and the provincial premier called for the Zulu nation to institute a new cultural tradition. And this is the tradition of adult male circumcision, something the Zulus hadn't done since King Shaka. And also our Department of Health began pushing for voluntary male medical circumcision. And they gave us very unrealistic target for this. However, we had a big problem as a medical facility. We knew how to do circumcisions. That wasn't the problem. The problem was we didn't know how to do it at the volumes that we were being asked to do. And if I was to allocate a theatre for circumcisions, then I wouldn't be able to do those surgical procedures that I needed to do in that theatre. So on the one hand, I could be saving lives with the circumcision, and then I would be creating problems for myself in the theatre. So what did we do? Working at breakneck speed, St. Mary's and Operation Abraham Collaborative. Remember, Enon mentioned how we met. So there was a serendipitous meeting of Enon and I in Durban in April 2010, and basically introduced by a mutual friend that has Enon in Lagos. Maybe you guys can put something together. And Enon was in South Africa looking for local collaborators in the arena of male circumcision, and I had the problem of how am I going to do so many circumcisions in such a short space of time. And soon Enon and I and our teams were working seamlessly and rapidly together on the first ever interfaith collaboration in HIV prevention through circumcision. We were in urgent need as a hospital of the support to get this up and running, and OAC, that's Operation Abraham Collaborative, at that time were led by Enon, were the leading experts in this arena. So a little bit about the Operation Abraham Collaborative. It's an Israeli non-profit organization, and they had highly skilled clinical and public health professionals who had pioneered the rolling out of adult male circumcision for a unique situation that Israel had faced in the 1990s, when 200,000 or so people from the former Soviet Union, adult male Jews but uncircumcised, had stepped up to the table and said, well, we want to be circumcised. So in a very quick order, Israel had to figure out how to do it quickly, rapidly, and safely, and they did. So they had that expertise which they shared with the world. And in 2006, OAC helped UNAIDS and WHO in the development of their guidelines on voluntary male circumcision, and these guidelines are still in use. So what we did in basically the space of 6 weeks, we converted a disused old warehouse into this facility that you see in front of us, a functional 4-bed operating room, reception, counseling area, pre-op and post-op areas, and even a small resting room for our staff. This clinic, which became known as Asipile, which means let's be healthy in Zulu, quickly became a center of excellence, training other teams from across our province, and a must-see VMCC project for the area. Now, the KwaZulu-Natal province of South Africa, it's a particularly multicultural, multi-faith province, but our staff and patients were fascinated and impressed by the staff of the Operation Abraham Collaborative, who were drawn from both Judaism and Islam, and the collegiality and professionalism shown by those teams served as an example for all of us. Together we created a well-functioning model of Christian, Muslim, Jewish, South African, Israeli, Senegalese collaboration for saving lives and mitigating AIDS in South Africa. And over the course of the project, which ran from August 2010 to May 2013, a period of 35 months, we circumcised just under 10,000 people, and the uptake numbers started up very well, and you get the low-hanging fruit, the people who are interested in the procedure, and then it sort of leveled off. And other results of that program was we ran 11 training missions. These were 2 weeks training sessions, trying to sort of have that multiplier effect. And those training missions trained over 100 team members from 12 other hospitals in KwaZulu-Natal. So we created other training facilities using Asipili as a model. And also we increased community awareness hugely in this arena. So as expected in any program, we did have some challenges. We were never able to meet the ridiculous targets that were set by government. But our targets and the volumes that we met were equivalent to other projects in Africa. So there's nowhere we were behind anyone else. And what the lower than expected output was attributed to challenges in identifying and recruiting new clients. And we hadn't realized the people side of it, that the amount of effort and time you need to do in allocating, looking for demand creation, that's encouraging the people to come to you, and the social marketing efforts. So at the end of our 2-week training sessions, where we trained other hospitals to develop their own programs, the multiplier effect, we had what a tradition which is called the Asapili jump, and this is us at one of the Asapili jumps, and a more informally dressed me jumping as well. And basically, it shows a newly capacitated voluntary male medical circumcision team that has worked hard and well together, having fun together, and showing that we are all humans created by God. Thank you.
Thank you very much, Dr. Ross, for this intervention, bringing us to the understanding that while we have concentrated on COVID-19, pandemics have been before, probably we have not seen the last of them, and talking about HIV, a forgotten disease due to COVID-19 has been a very important point of remembrance. So our travel will now go to Mount Sinai, because that's where the Torah was given to the people of Israel. And I would like to invite Professor and Rabbi Avraham Steinberg to talk to us about the essence, the core of the messages coming from the Old Testament and how they have translated through history into real action when we talk about this junction between faith and religion. You can read about Professor Steinberg's, like all other members of our panel and moderator and presenters, in the bios in front of you. Professor Steinberg, please.
Thank you. Being the last and the least of the panelists at this stage, before going to the panel discussion, I want to express my and our thanks to the municipality of Karlsruhe for hosting us, and particularly to Dr. Yinon Shenkar for the hard work he put in, and I am part of knowing how much work it was in order to bring it to fruition, very successfully, very inspiring, together with Julia, it's here, that really did a lot of, here she is, did a lot of administrative work without which this wouldn't come into fruition. So prior to vaccinations at large, there were quite a few numbers of epidemics and pandemics since biblical times until vaccinations were invented and even beyond. So here is a partial list from the Old Testament about epidemics that occurred during biblical times, as opposed to the COVID, which really is global. In these days, it was usually limited to either the Jewish people or to individual nations, but there were quite a few of them with relatively high numbers of mortality. I won't go over the whole list for the sake of time, but whoever wants it can copy this slide. In the Middle Ages, the most famous pandemic, much worse than what we are experiencing currently, was the Black Death or the bubonic plague, because it was a plague created by the pesticides which caused bubonic eruptions. In this unfortunate pandemic, over 50 million people died throughout the world. Hopefully we will never reach these numbers with COVID. At the moment we talk about maybe 10 million or a little less. So this really, relatively to the population then, was really a very significant pandemic. Other pandemics in modern area include 7 rounds of cholera epidemics that lasted over 150 years combined, the 7 rounds, again causing millions of deaths. The latest, the Spanish flu, a century ago, right after World War I, caused also a few million lives. And recently, the Ebola, the AIDS, the SARS, and others. And currently, we are in the COVID-19, started in 2019. That's the name given to the pandemic. But it is still going on, and hopefully, it will finish in the near future, although one can never be sure. Now, some lessons, I think, can be derived from a moral and from a theological point of view regarding this pandemic. The first one, I think, goes to the scientific community that calls for some humility and modesty. I'm a physician. When I studied medicine, virologists said, if Spanish flu will never recur, we know virology very well, we will know how to control it, and nothing of this kind will ever happen. And here comes a new virus. We have no idea how it works. We can't control its mutations. So a little bit of modesty is a lesson to learn. I think also that from a religious point of view, it is a sign of the Almighty's power over the world, because scientifically it's unexplainable. We don't understand how it spreads this way, how it creates new mutations, how we fight it, and yet we fail. It must be some power that brings it down. I think also from our point of view, as human beings, seeing this disaster happening and so many millions dying and even more millions getting sick, some of them with long COVID consequences, calls for deep introspection, both on an individual level and in a communal level. We should think about ourselves, how to behave better, how to be better, and how to help each other in a better way than we did so far. And importantly is that we should learn that the general behavior and the obligation to adhere to governmental and health professional authorities is a very important part of containing this epidemic like any other epidemic, and in particularly, it is so important to be vaccinated both for the individual's sake and for the society at large. When vaccinations started to appear, it was found that this is the most effective method of preventing any infectious disease as long as there is a vaccine. The vaccine was effective to eradicate smallpox, which caused the lives of millions annually, and now it is actually eradicated. It much restricted the epidemics of polio, of measles, of tetanus, of German measles, and many other infectious diseases, so that by now we have about 25 different preventable infections by vaccinations, and therefore society has become a more safe and healthier environment due to vaccinations. The religiously based objection to vaccination, and there are some religious leaders who feel that this is wrong from a religious point of view. One such argument is, you shall be wholehearted with God, your Lord. The meaning of it is that you should rely on God and not interfere in a human way when you are healthy. We are already past the period when some sects of religion said that you can't use physicians at all, even when you are sick, because you are sick because God wanted you to be sick. Who is the human being to interfere and overcome what God said? So that, I think, today, there are hardly any religious thinkings that say that you shouldn't be treated, certainly not in Judaism. However, in a preventive measure, when you are healthy, who are you to intervene and do something in order to avoid something which will or will not come in the future? So that is not a human task. That is certainly a mistake, because we are obligated by religion to do all we can by medically, scientifically approved means through which God will help us. God indeed is the final authority, so to say, that will or will not help a certain individual, but he will help him only if you will do what intelligence that he installed in you is used properly. So therefore, from a religious point of view, preventive medicine is actually better than curative medicine, because you really avoid this stage of being sick. Another argument is that as long as one is healthy, she or he should not interfere with nature. So again, preventive medicine is as important and sometimes even more important from a religious point of view to cure and heal. Other arguments are concerning the side effects of vaccinations. It is true that some of the vaccines and to some people may have some side effects, and therefore the argument is that one is not allowed to put himself in danger, one is not allowed to cross a busy street where he's not allowed to cross and be run over by a car. It is something that you should avoid, so therefore they argue you should avoid putting yourself into danger. But again, that is a grave mistake, even from a scientific point of view, because the risk-benefit ratio is clearly in favor of vaccination. Nothing is free of any side effects. Even crossing the street by law sometimes ends up badly, and it doesn't mean that you should sit at home and never go into the street, because you might be hurt there, and that is the risk-benefit ratio that we always take, and certainly with vaccination, that is a ratio in favor of vaccinations. Doesn't move? Next one, please. Okay. On the other hand, there are clear sources, theological sources from the Bible that points to the fact that one must do what science and medicine is teaching us to do in order to preserve life and avoid risk. One such statement is, but take utmost care and watch yourselves scrupulously, and for your own sake be very careful. These are biblical verses from which we derive the obligation to safeguard our body from danger. It is a direct order. Another statement is, you shall make a parapet for your roof so that you do not bring blood guilt on your house. You have to do preventive measures in your house or in your environment or to yourself in order to avoid harm when you can do it. And that is what medicine and public medicine is all about. And based on the verse in the beginning of Genesis, and man became a living soul, the Jewish sages interpreted it as a comment by God. And the comment is, the soul I placed within you, preserve and sustain it. So at the very beginning of the creation of man, he was already ordered to do what is best to preserve his body, his soul, himself. And finally, do not stand by the blood of your fellow means that there is a requirement to do whatever possible to save lives of others. You are in charge not only on yourself, there is a solidarity, there's a mutual obligation, so that you should do whatever is right, not only to save yourselves but others, and certainly avoiding the infection and spreading the infection to others is something that we are obligated to do, and the means to do it is to vaccinate myself so that I will not be a danger to my fellow men. And finally, I just want to bring one statement from Maimonides. Maimonides says that a pious fool who refuses to allow a physician to help him, but relies totally on God's help, is like a hungry man who refuses to eat bread and hopes that God will heal him from the illness of hunger. The sick person who is not following medical advice and dies of disease is equated to someone who enters into a fire which surely will kill him, so he is responsible for his death. In other words, whatever you know how to do best to save your life, you are obligated to do it, not less than you are obligated to eat, or you are obligated not to enter into fire, because all these are natural, avoidable situations, and that is your obligation to keep it. Thank you very much.
Thank you very much, Rabbi and Professor Steinberg. We have heard three, in a way, introductory presentations that could get us rolling to the final part of our meeting today, which is our distinguished panel. We are in Germany, and time in Germany is something that is preserved very punctually, but we are also coming from other cultures, like Israelis that are always needing to see time in perspective. And so I just want the audience to feel relaxed, because we shall be allowed to stay a bit over in order for the panel that has extraordinary individuals and a moderator to guide us to bring more wisdom to what we have just heard. And it's really a great pleasure to introduce to you Reverend Deacon Christoph Elsiepen. It's unusual that someone will get a phone call, not in the middle of the night, but close to that. And on the other side of the line will be somebody that he hears for the first time, that would seem to know everything about him and his roles, also, for example, as the chair of the board of the Hermann Maas Foundation, and invite him to moderate a panel in Karlsruhe, which is not too far, because this gentleman lives in Heidelberg, and that he will say yes to that invitation. It is a special personality and a caring one, as well as a determined intellectual and emotional, I think, responsibility that combines in the featured moderator that has been granting his time to us. And so, Christoph, I really want to tell you from the bottom of my heart how moved I was to have this very first conversation with you, and then meeting you for the first time this afternoon here in Karlsruhe. And Heidelberg and Karlsruhe are maybe 1 hour drive or so, but the connection to Hermann Maas and the church that you lead there has much more significance than the period of time traveling from Heidelberg to Karlsruhe. And so we hand over now the microphone to you as our director for the panel and our moderator, with great thanks.
Thank you for...
Maybe the panelists would like to join.
Yes, of course. Just take a seat wherever you want. So thank you very much for your warm welcome, Inon, and for the invitation to be the moderator here. I want to tell some few words about Hermann Maas, because this was the junction that Einar Schenker took to ask me to be the moderator here. Hermann Maas was a parson in Heidelberg at the Church of the Holy Spirit there, and during the NS regime he was very important individual to resist the anti-Jewish efforts of the states. He was a very friend to Jewish community and helped people to emigrate or to hide. So he was the first German to be in Israel after the war, and was granted a tree in the alley of the righteous among nations in Yad Vashem. So it's a big honor to me to be some of his, that he is my predecessor in this function. So I'm very pleased to have this this panel here. So sorry. And we heard about 3 of you were speaking here. So I would like to introduce first Dr. Blum, who comes from Haifa here. And she is a physician, family physician, and she works in the organization of health services in northern Israel, especially with the ultra-Orthodox community. Then sitting next to her, there's Karina Dinkel, and she is a physician, a family physician as well, but she's working on a very different field. She is a doctor within the DFEM, which is the German Institute for Medical Mission, based in Tübingen, here in Baden-Württemberg, but her projects are mostly in Africa. We're keen on having you when you talk about your experiences. Then we welcome Mr. Rushdie Aslandour. He already spoke to us. He is head of the German-speaking of the German-speaking Muslim circle here in Karlsruhe, and we're very pleased that you're with us. Rabbi Steinberg was already introduced, and Mr. Ross from South Africa. So I would like to start the conversation with an open question, like we are talking about health and religion. And you are all working in either the one or the other, or in both. And so I would like to hear from you, what's your experience in your special field with the collaboration of these fields and maybe of interfaith aspects in this? Who likes to begin? Yeah, Mr. Steinberg, Rabbi.
It is a huge field, both the intra-religious and the inter-religious aspects of medicine at large and public medicine in particular. There are many ethical dilemmas which are the same for secular community, but are strengthened and have different approaches from the religion's points of view. Some religions agree with others, some disagree, and there's a whole host of issues. I'll mention just briefly a few, and then I'll focus a little bit on the pandemic as an example. So one of the major areas of discussion in public health and in individual health is end of life. Nowadays, like always, people die, but the way people die now is much more complicated than it ever used to be. We have a lot of ways to prolong life, but not always is the prolonging of life for the benefit of the person. He may suffer, he may be demented, he may not enjoy the prolongation of life. How do you deal on an individual level with a particular patient who is dying? What do you do for him? What don't you do for him? How do you palliate him? Many, many questions. As well as from the public point of view, do we need a law that regulates it? Do we deal with each individual the way his physician and his family want it to be dealt? Many questions of this kind. If we go to the beginning of life, not easier than the end of life. Questions of artificial insemination and in vitro fertilization and PGD and abortion and prevention of pregnancies and so on. There are many, many questions. Some of them are mutually accepted as allowed or not allowed. Some are disputable. Some countries allow certain things and not others, and so on. And some religions are for or against some of these issues. So we have a whole host of issues from the beginning of life to the end and all in between. If we come to the pandemic, one of the issues that we dealt with, actually I'll mention two that we dealt with in Israel. One was a triage decision. If there are not enough ventilators and you need for many more people to save their lives, but you don't have enough. So if 20 people come at once and all need a ventilator and you have only 5 free ventilators, who do you give it to? So it's not new for the pandemic. In the military ethics, it comes up more frequently during war, during catastrophes, now in Pakistan, so many people are drowning and earthquakes and so on. But here it was a civil mass issue that almost everyone could fall into the question, would he be treated or not, for lack of resources. So that is one issue that we dealt with. We wrote, I chaired a public committee that wrote guidelines which were not easy to write because it's a matter of life and death when you make such a broad decision, but it has to be done, and that was implemented in the Ministry of Health. Another issue that is related, and I'll finish with these remarks, is the issue of vaccination that I mentioned during my presentation. There are some people who don't believe in the vaccines, who think that they are more harmful than beneficial. Amongst them are not too few religious leaders. Some of them felt that indeed that is the wrong approach. I hinted to some of the arguments why they thought this way, and our effort was to bring as many as possible leaders of the different religions to say that vaccination based on science are the right way to do. And Dr. Yinon Shenkar and myself organized a convention in the Israeli president residency with his participation when the Minister of Health, and we invited all the heads of the religions in Israel, Christians of different kinds, Muslims of different kinds, Druze, Baha'i, Jewish, many heads of religions, and we wrote a declaration stating that vaccination is the right thing to do and calling for the believers in all respectful religions to come to it, and all signed on it, and I think it was something to impact the outcome.
Thank you very much. Maybe we stick to Israel, and I hand it over to Mrs. Bloom.
Yes. Is it working?
Yes, it works.
Yes. Well, I want to talk about a few points. From my experience as a family physician and also as a medical director in one of the major HMOs, Maccabi by chance, but one of the HMOs in Israel. And my work with communities, larger and smaller, I can talk about two major communities that are connected to what we're talking here. One is my work as a medical director in a clinic in a ultra-Orthodox community. And the special relationship we have with the religious leaders, the rabbis, which they have a large influence in that community. And early on, as a medical director, understood that I have to work with the religious leaders hand in hand, that we have to give information. I don't think we have to educate. We have to give information about why it is important and how is it important in the eyes of the Torah, of the religion, that people should do preventive medicine. I'm not talking only about the pandemic. It was very important during the pandemic. It's something we started before because, you know, we've lived before and we'll continue living after the COVID. And what I did with my coworkers is that we did an outreach to the rabbis, and we came to speak to them directly about the importance of preventive medicine, even, of course, in the eyes of the Bible and what we've already heard. And so that's what we did. We went one by one, and we met all the leaders. And from this initiative, what happened was there was a bigger congress, a reunion of the rabbis, major rabbis in the northern area. And I even brought here, what we made was a book. It's a book, a small book, but it's a book about preventive medicine in general, which we say about also for vaccinations in general, not only vaccines. But why should a person do some blood tests? Why should a person keep himself healthy with his weight, diabetes? And what we did, we wrote it in a very, in a way that it's a respectable way, because there are certain things we have to understand in different religions. There are certain words we should not use. So everything was written in a way that it will be also accepted. That's one of the things. And actually, the result was that we get a much better cooperation of the population for the projects that we want to do. Another experience I had was on the other side, was of the Muslim population, which is also, it's there when I was the medical direction in a Muslim village, also in the north, is that it's important. What I learned is, of course, to collaboration with the mosque and using the mosque as a place for education, and also the understanding that you have to understand the culture and, for example, the holidays. If you're working in a Muslim community and you do not understand that they have the Ramadan month and that they will be fasting during the day, it will be very hard for you to be able to take care of their diabetes. Because if you have diabetes patients and you don't take into account, you will not go and say, don't fast, you have diabetes. No, that's not the way. You have to learn how to take their religious beliefs and what they do, and then to be able to help them. And the best way, of course, is to engage health workers that work in the area. That's what we did. Health workers from the community or from the same religion. And so they will do part of the, this reaching out to the community. And the only thing I want to say also about the Interfaith, I would invite anyone to come to see my clinic, the clinic where I direct in the ultra-Orthodox area, the ultra-Orthodox, it's not a city, but it's that if you see the people that work there, we have Christians and we have Muslims and we have religious Muslim nurses taking care of the rabbis, and everybody's living, in the same sense that the objective is to have a healthier community. So,
Interfaith is helping one another.
yes.
Maybe you can just take it over, and Mrs. Dinkel, to add your experiences you have with your projects in Africa.
Yes, it's okay. Okay. I'm just remembering your initial question about medicine and faith. So I do believe that all humankind is made in the image of God. And that is one of the reasons why I studied medicine, because so every life is precious and has a dignity. And every life deserves to be preserved. Every human being deserves healing. And Rabbi Steinberg talked about the triage problem, like having too little ventilators for too many people. And we had that discussion in Germany as well. But I look to a continent with millions of people, and I work with people on that continent. that don't even know what ventilators are. Before the pandemic, there were African countries, there was actually, I think, 7 African countries where there was not a single ventilator in the country. So treatment for corona was basically no option. And what to do? Those people are created in the exact same image of God than we are, than I am. And there is not many resources that those people in those countries had initially. And if you remember the time when everyone was fighting for masks and protective equipment and every country just tried, okay, Germany buys, I don't know how much masks at exorbitant prices so that nobody else would get it. Everyone was just looking at himself. And leaving aside those people who didn't have the resources to even join in that fight for masks, PPE, whatsoever. And so as treatment was no option, kind of the only option to spread corona, to stop the spreading, or at least to slow down the spreading of corona, was community intervention, like the social distancing, like the mask wearing, like the hand washing. And that is in societies that still are much more communitarian societies than, for example, Germany, even harder than it was here. But that is the only way, or was the only way, to slow the spread and to prevent those created images of God from dying. And that is why DFM engaged in lots of programs in many, many African countries with especially religious leaders for community sensitization, for bringing social distancing, bringing mask wearing, all those topics that are kind of far out of the horizon of the people there. They were far out of our horizon as well before the pandemic. To bring it to the people, because the faith-based leaders, they are the ones who are trusted. They are the ones who reach regions where government doesn't reach, because that's the neglected regions. There are lots of them. And that is why in pandemic, working with faith leaders is so important. And it is very in Germany. The churches, the mosques, yeah.
Ones from all the leaders. But I think when you get down to it, there is a crossover between, the crossover is that both the faith, whatever faith you are, and public health is about, at the kernel of it's about health and healing. And that is central to, I think, any religion, and the public health specialist could also find that hard to argue. So in a way, in the face of a pandemic, one has to look at what can be done, what is possible, and just get down to it and do it. And I think in Africa, people did it.
Yeah. I think what Corona and COVID teaches us again is that diseases don't differ between Christians and Muslims and Jews and secular atheists. So this is experience, or this is what we see. And I think God gives also a message with this. And I find this message also in the Quran when I read a verse in the Quran that goes, "Ta'awanu al-birri wa taqwa, wa la ta'awanu al-ithmu wal-udwan." That means help each other in good things and in responsibilities, but don't support each other in enmities and in bad things. That is a general rule, I think, for the whole mankind, either we are religious or not. And what I discovered, or discovering again and again, is, for example, Rabbi Abraham presented his PowerPoint, and I tried to follow it carefully. And nearly everything what he said, I can go with him. Maybe I will pick up other verses in the Quran or some sayings of the Prophet. But what I learned in the interreligious dialogues is, it is not this distinction between the Jews and Christians and agnostics or so on. It's the mentality, how you approach to your sources and how you see mankind, how you see the other man and how you want to treat him. You can believe in certain religion, you can be convinced in one religion, but that doesn't mean that you cut your connection with these other people and you you are yourself. And it is really a wonderful example what Rabbi Aaron says, or my colleague here, that they are, and this was also this big speech of one of these beginnings. We should go from the first step of speaking about what is good, of doing what is good. And this is this best examples. I'm not a medical doctor, I think the only one here, but I have experience in local experience in dialogue. And this is about values. What values do you have as a human being? Your values could be derived from your religion and from your own sources, religious sources, but it should be useful for other people too, not only for your own people or only for religious people. It should be for all people that you should benefit for.
Yes. I mean, I think one of the things one of my take-homes is that when you look at interfaith initiatives in the peace arena, I remember someone saying that if you want a peace initiative to fail, then leave the religious leaders out of it. And I think there's a corollary to that in the public health arena. If you want to have a successful public health program, you've got to figure out a way of getting the religious leaders on side and to be part of that program.
Just to corroborate with what you said, I think that there are so many common things between the major religions, despite the differences. We can't avoid that there are differences, but most differences are theological, and most common acceptable theories are on the practical level. And I think that really, practically speaking, we can be a force in the world only if we talk together and we come out as a mutual call. That is what we try to do in Israel at the President's house. We got all the heads of the different religions that on a daily basis, I'm not sure how much they talk to each other or agree with each other. But on such an issue, all came, all signed the declaration, all went back to their communities and said that everyone, all religions agree to what I'm telling you. And I think that is an added power to fight epidemics, besides obviously science and medicine.
Maybe at this point I will quote Rabbi David Rosen, International Director at the American Jewish Committee and a co-leader of the Jerusalem Impact Vaccination Initiative. And he says the religious leaders should lend their authority to the medical and public health efforts to combat the pandemic, what we heard now, combat misrepresentation, fight inequity, and third, combat disinformation that undermines the process. And I want to lay the stress on the third, the disinformation. What could we do as religious leaders as well in collaboration with health services to fight misinformation? Because here in Germany, there's everyone who wants to be vaccinated can be vaccinated, but there's much misinformation, and some people think it's not good to be vaccinated, and the arguments are very very much and often are not scientific ones. So what do you think about this? I know you, Mrs. Dinkel, you're fighting it at some level, and I was astonished when we talked to another how. So could you share this information with us?
Okay, I wanted to start with something else, but okay, then I'm coming back to your question. Misinformation is a big problem in the pandemic. I think every one of you is aware of that. And it becomes even more severe in countries where there are language barriers. So here in Germany, we can access German information. But if you go to different other countries where people speak native languages, you find that most of the WHO information is in English only, not even in French. So my horizon mostly is Africa. So when you look at the Francophone countries in Africa, misinformation is a much bigger issue than in Anglophone countries, because valid information is not so widely available because it's English only. And then we're just talking about French-speaking people. There are Swahili-speaking people, there are Oromo-speaking people, there are hundreds and hundreds of languages where information is not readily available. That's again one point for faith messaging, because faith leaders normally talk the language of the people. So they can translate things. They can not only translate the words, but translate meanings, pictures, impressions to the people so that they really can understand what things are about. And that is one thing. The other thing is that also medical information is not so readily available for many people from low resource settings. So WHO information, although for people from our setting it might seem basic, in many cases it doesn't hit the reality in low resource settings. So there needs to be a breakdown, a translation into those settings. That is something what we started at the DFEM with introducing WhatsApp groups, especially for medical personnel in low resource settings, with issuing podcasts every week, very short ones on vaccines, different types of vaccines, on different measures, also the topics that are related that don't come to our minds, like what about, well, it does come to you, what about COVID and HIV? What about COVID and TB? We don't discuss that here in Europe, but it's important for the people in other settings. So having valid information in an accessible way, breaking it down so much, it's basically aimed at healthcare personnel, but there's also pastors who listen to those podcasts so that they can share in their communities. Information really made available at a very, very basic level. This is so, so, so important if you want to fight misinformation, and it has to be also brought by somebody who is trusted, which again goes with religious leaders. The other thing I wanted to say was about, it's also about misinformation and what religious leaders can really do. And I wanted to talk about Tanzania a little bit. I think most of you know that they had a president who was declining the existence of COVID. And the bad C word was even banned from public speech. And there were some small measures, but not very widespread. And in the end, it was the religious leaders who stood up to the president. There was a joint initiative from the Catholic bishop, the Lutheran bishop, and the Sheikh, so the Muslim, and they stood up publicly to the president and said, okay, but it is our obligation, our duty to care for the lives of the people, and people are dying, and they are dying from COVID. There, we said it, it's real, and we have to do something against it. That was in times when COVID was still not talked about in Tanzania. And So yeah, this is also fighting misinformation. And that has all the more weight if all the religions stand together and do it in a joint initiative, and not just some bishop saying, yeah, maybe, but really joining forces as faith-based leaders and making a strong point. And there you can see that they can make a strong point. After that, it was talked about.
Yes, I think too that two factors that this disinformation are spreading. First of all, of course, education, and the second is the trust. And we see it not only in other countries, we see it in Germany, that these conspiracy theories are so much, and we know, the Germans know this Querdenker movement. So I think what these people who spread this disinformation have are this: either they don't know what they are spreading, or they lost this trust to the state, to these official institutions. And I think too that religious leaders can give more trust if they are approached to that. For example, the state or this institution of these societies bring them together and try to reach them. This I think it is not so much done in Germany, but what I saw, and this is also a good initiative, that some mosques in Germany had this vaccination campaign in their mosques, and that means they are giving trust to people that this is good, and we as Muslims support this kind of vaccination.
I would like to add another perspective. Besides the language barrier and the mistrust, there's also sometimes no information. It's not only misinformation, but no information. And especially in certain ultra-Orthodox Jewish circles, the no information comes from their rejection of the technology. Podcasts won't help because they don't use it. They don't use television, they don't use internet. So how would they know what's going on around? And then if someone fills their gap with their own agenda, why they are opposed, then it becomes their understanding that something is wrong. And especially in Israel, in the initial stages of the pandemic, one of the rules of the government was to close up all types of gathering, which meant to close up schools, to close up synagogues. And the ultra-Orthodox people who did not listen to the news the way we all listen understood that this goes against them, that there's an opportunity to hurt them, because there is a fight between the government and these particular groups. And here the government orders to close the most important part of their life, to go to schools and to go to pray. So it took a long time, myself and others, to get directly to the leaders to explain to them why it's done. It's not against them, it's done in the whole society, it is done for their benefit. Here are the facts and here's what happens, because they never heard about it. They didn't have the communication, the modern communication. So there are many variables why certain religious leaders fail to cooperate. And if you don't realize what it is, if it's a language, if it's trust, if it's no information, then you may mix up the remedy and give the wrong remedy to the wrong person. And therefore, I think it has to be looked at globally and individually.
Well, that's why what I was saying, like what we did in my small community, that we outreached directly to the rabbis. And it's very important, I think, is how we give the information and through who. Sometimes the problem is that if the information goes directly, let's say even from the government directly to, they think maybe, rightly say, maybe it's against us, maybe they're trying to manipulate. I think there has to be outreach from people from the communities. I think they have to also outreach to the religious leaders and in their own language. And the information has to be given, like you said, in a way that a person won't feel, oh, they think I'm, not intelligent, or, it does not have to become, has to be eye level when you're giving the information. And I think we can be very about how to give the information. I'm going to take it from the Orthodox communities, that you can find low-tech ways to give the information. For example, today you can even use a very simple phone. You can do broadcast through simple phones. You can, dial a number, and then you can broadcast. The person does not have to have today an iPhone to be able to do chats. There are very ways, and for example, these ultra-Orthodox, they use it. So we can actually give and make outreach. Let's say we can talk about diabetes, we talk about vaccination through this, just by a regular phone. You can, people, and so not everything has to be very high-tech. We also can low-tech do it.
The motto of this World Council of Religions, World Council of Churches, and I wanted to bring it to religions, is the love of Christ moves the world to reconciliation and unity. And maybe in this context we could say the love of God moves the world to reconciliation and unity. So my last question to the panel is, what is needed for future in this pandemic that still lasts? What is needed, in your opinion, that this being united, religions, mankind, how can this be seen? How can we do it? What can we do it for it, that it shows this unification of mankind through religions?
For me, I'm still harping back on HIV/AIDS. That's far from over. So I think there's a pandemic that's still buzzing along there. So from my point of view, there are initiatives. In other words, the multilaterals like the World Health Organization, UNAIDS, and all the rest of it have realized in the last 10, 15 years how important the faith communities are. And there are a number of initiatives bringing those two entities together to try broaden the levels of understanding, work collaboratively together. There will be areas of difference. We accept that, but it's more looking on areas where we can work functioning together. And I think that needs to continue and be strengthened, so that the public health, the technocrats in that arena work seamlessly with the faith-based entities that are functioning in health, and even the religious leaders who need to communicate appropriately with their communities, etc. So for me, that's where the next challenge will come. Is not to forget what we've learned in the last two pandemics, but actually take it to the next level.
I think if anything good came out of this pandemic, and most is bad, but some good things come out sometimes from bad things, is that I think the faith leaders learned to cooperate, which wasn't at that level ever before. So Muslims and Jews and Christians and other Eastern religions learned to speak together, to find out what is necessary to promote the health in their communities by learning from other communities. And I think that is a good beginning for, hopefully there won't be such a pandemic, but as we know, it is something that we can't expect. So there will be another pandemic and maybe even worse. So at least take it from this level, don't go back. And we need to deepen this type of relationship to maybe establish even ahead of time groups that will be mixed with scientists, field people, public health experts, and religious leaders from the different religions, so that it will be sort of as a standing committee for time of necessity. And I think that we'll learn that this is a possibility, and that will be certainly helpful.
I think that religious people also, and non-religious people, but especially religious people, should change their mentality if they don't have this. If you love God, you love His human beings and His the whole world, the environment. That means if you help the people, you support what God wills, God wants to do. And the core of all religions is to do good. And one thing you can do good is to do good to people. This is not to...
Liebe Besucherinnen und Besucher, bitte beachten Sie, dass die Sammlungsausstellung in 15 Minuten geschlossen wird.
Okay.
Sonderausstellung bleibt weiterhin inklusiv bis 18 Uhr geöffnet.
This is not a sign for me.
Thank you.
Oh,
it was not for you and for us.
Yeah, and then we see that internet showed us that this is the whole world is a global village, and we saw the beginning of this pandemic. It came so fast from China to us, to the whole world, that we can understand now that local isolation or local solutions are not valid anymore for us as mankind. We have to deal together with not only with these global problems, also in local situation, come together to solve it. And we can also still be good Muslims, good Jews, good Christians, but first of all, we should be good human beings.
Thank you, Mrs. Stinker.
What we should take or learn from the pandemic. First, I want to say I'm still impressed by the presentation of Benjamin, with all those different people being engaged for vaccination and how you really did it, because I know it's so hard. We are here and we are talking, and it sounds as if that is all easy. It is not. And from my own perspective, I think the most important thing is losing fear of talking to each other. Really, really talking to each other. And we are all different, but everyone knows where he or she stands. And we can work together because there's a lot of common ground. And I have to admit, with the pandemic, we started working with voodoo churches. And I was like, voodoo, oh my goodness. And I had all those pictures and misconceptions. And a lot of it was misconceptions. So yeah, you really have to start to talk, lose your fear, start communication, and you get somewhere. And we have made a start in this pandemic, and I think we did some very, very important steps. It started back in HIV, and now it was really, really impressive what the Jerusalem Initiative did. And I'm convinced we can do that globally, not just in one country, but we can do it globally. But we really have to work hard to do that. Lose our fear, go together, because together I think we can really make a stand, and we can make a stand as religious people, also in countries where government is not doing a nice public health approach. We faith-based organizations, we can be a partner also to UN organizations and WHO. We can talk together. We can be a partner, which we so far are not. But if we stand together, and if we stand up together, really together, then we can do it, and we can be that.
what I feel is the important thing is, of course, like I said, how you give the information. It has to be in a high level. And when I think it's important, like Rabbi Arvam said, that really the religious leaders work together, but I think it's important to have the community, people that live the day-to-day, from different communities to be part of these initiatives. Because if we don't do outreach directly also, not only with the religious leaders, but you have to outreach directly with the people that live the day-to-day, you might miss something because they have to feel part of it. I think these people in the communities have to feel part of it. And I think that any project has to understand, that we want to do, has to understand the needs of certain communities. And if we're talking about Israel and the pandemic, I'll give you an example. We discovered, in the beginning, we couldn't spread the vaccine to all the different parts of the country. And very fast we learned that in the Arab villages, if we don't bring the vaccines to the villages, people won't come. They want to do the vaccine, but they have a hard time. They can't take the buses. They have a hard time getting out. They need maybe the religious leaders and also their doctors, their local doctors. So the moment we were able to bring the vaccines to the clinic with the people around, suddenly we had a huge amount of vaccines. So it's important to know the different communities. And one of the things that we have, it happens in Israel, like I said, is that all religions and beliefs work together. We have it. Like I said, we'll have working in Arab communities. Jews will be working in Arab communities, and Muslims will be working in ultra-Orthodox Jewish communities, the nurses, and it's okay, and they will come dressed how they want to be dressed. It's not a problem that everybody will know. And I think what happens is that once you have this integration from this level of people working together, they bring it home. And then it's much easier also to give this, also for the religious leaders and the leaders to be able to do work together.
So thank you very much for this panel, and I give the word over to Inan Schenker.
Thank you very much. I would like to use 4 words in concluding, but maybe also at the same time in opening for further discussions and activities. But before coming to those short 4 words and my very short concluding statement, there is a point of giving thanks. And I would like to give thanks first and foremost to our audience, people who have decided to be in this room and not in other rooms. So thank you very much for choosing this activity of the Encounter program that has been hard worked here in Karlsruhe. And second, obviously, to our panelists and moderator and speakers that have come from so far away and so close by for the same purpose of actually trying to convey important messages that I will summarize in those 4 words. But you know that these kind of activities could not have happened without some support, and it is really an opportunity, not just an obligation, to be thankful to those donors who have provided financial assistance to this effort. They come from EKD, from Miseror, here in Germany. They come from the Israeli Foreign Affairs Ministry, and they come from several individuals who have asked to stay anonymous and who have provided private funding in order to enable all of us to be convened here and to carry out this mission. The 4 words I want to share with you for reflection, for thinking, for summarizing in a way are solidarity, collaboration, and maybe I'll add another one, which is inspiration. But I was... So inclusiveness, collaboration, respect, solidarity, and maybe inspiration as a fifth word. And I could leave you actually with those 5 words without saying anything else, for you to reflect on what we have heard today and what we can do tomorrow, which could start actually this evening, in fulfilling what we believe personally, religiously, communally, or in our public health and medical profession, in the connection between those 5 words and what we have heard today and what we would like to do tomorrow for a better future. So thank you very much again, and we would like also to invite you to visit the booth that has been granted to us by the World Council of Churches. It's actually the very first booth that is very clearly having the sign of the Jerusalem Impact Vaccination Initiative together with EKD at the line of tents that are presenting, and you will see more of the information that has been shared here, as well as the ability to take QR codes to even learn more. Thank you. Best evening to everyone. We conclude this event now.